I'm Dan Duncanson. I'm an internal medicine and primary care physician at SIMEDHealth. Arteriosclerotic cardiovascular disease. So let's break it down. Cardiovascular system is a series of tubes. The heart is obviously the center of it. It's the pumping function that pumps the fluid through the tubes, leaves the heart and goes through the arteries, and then capillaries when it's down at the tissue level. Blood comes back in the vein, back to the heart, and circulates through. So that's the cardiovascular system. The atherosclerotic part of ASCVD is athero comes from Greek origin. Athero means sludge or plaque. It's an unfriendly plaque. And then sclerosis is a hardening. So you have an unfriendly plaque-like hardening in the cardiovascular, mainly the arterial system. Cardiovascular risk calculator was developed by two organizations, American Heart Association, American College of Cardiology. And what it does is it compiles all of the known risks. We plug in all the known risks that a person may have for a 10-year chance of them having a cardiovascular event. And it puts those all on one tool. We use the risk score for helping people decide how aggressive they should be for their known risk factors. If someone already has arteriosclerotic cardiovascular disease, then they're already at high risk. There's no point doing the calculation. But for those who maybe don't have anything going on and they maybe just have a high cholesterol, you plug all their information in and then it determines whether there's a risk high enough to justify starting a statin medicine. Basically, if it's 7.5% risk, that's 1 in 13 people in the next 10 years will have a major event. The indications are started. That's considered intermediate. If it's 20% or higher, 1 in 5 or more people, then it's very high risk and we should do everything we can for them. You improve your risk score by improving the controllable risk factors. You can't control your age, your sex, your race, but you can control your blood pressure. You can control diabetes. You can control whether you're a smoker or not. You can control your aerobic conditioning. That's your exercise level. So there's lots of things you and your physicians can work on together to lower your risk factors. You lower your risk factors, you lower your cardiovascular risk score, and it decreases the chances you're going to be that one person in the next 10 years that has a heart attack, stroke, kidney failure, or amputation.